that we lack the power to pass the Protecting the American Workers Act that's languishing in Congress. And when I got up this morning and was preparing to come here, the news bombarded me that a district held by the Democrats for over 100 years, it's the Wiener's district, had voted for a Republican. The challenges facing us are not new. Some still seek to divide us. Manufacturing against service sector. Private sector versus public sector. Black versus white versus Latino. Citizen versus immigrant worker. Employed versus unemployed worker. By religion, by our legal status. It's an old and still, unfortunately, successful tactic. I don't know how many of you have had the chance to read the discussion papers. They were excellent. They raised critical questions. You have a copy of the summaries. Please pay attention to them. This is what we're going to be discussing, those questions and more as we go today and tomorrow. I want to spend just a few minutes talking about what remains. The occupational disease with the highest prevalence and the most persistent inequalities. Unemployment. This is the poster child for job insecurity. And the figures from last month are dire. It's not just that we created no jobs last month, which anybody in my neighborhood could have told you. But black unemployment remains, as it always is, the highest, 6.7%. The highest it's been in 27 years. The rate for black men is even higher, almost 20%. And the rate for young blacks is over 50% in most places. Black unemployment has been above 10% every year for the last 10 years. This is not an individual problem. It's not a problem defined by low education or immigrant status. It's a disease that's creeping across the nation, and the workers that we're talking about at this conference have higher unemployment rates too. Immigrant workers versus natural-born workers, Latinos versus whites. We should pay attention to the fact that today, the Economic Policy Institute estimates that fully a third of all American workers were either unemployed or underemployed at some point in the past year. Think about that. A third of all workers, almost a third, were either unemployed or underemployed in the past year. And that rate's higher for blacks, 36%, and for Latinos, some 41%. Black and Latinos have experienced the largest drop in wealth in the history of the nation. Today, people consider themselves lucky to work in a job guild. There was a time when we were fighting to break up job guilds. This means more people are poor. More than 10% of our nation's children live in deep poverty. That means they live below half the poverty line. Below half. You know about the wealth gaps in our country, the worst since the 1920s. And the reality is that from the end of World War II to the mid-70s, we saw growth. We saw economic prosperity. We saw salaries and incomes rising. We saw unions growing. We saw health inequities shrinking. But since the last several decades, since the late 1970s, things have reversed. We've lost ground. Between 1979 and 2005, the bottom fifth of our population increased their income by $200 over all those years. That's like $8 a year. In that same time period, the top 1/10 of a percent, 1/10 of a percent, saw their income grow by $6 million. Today in the United States, the top 5% of the nation owns over 60% of the wealth, and the bottom 80% barely holds on to 13% of the wealth. So what do we do when we come here and think about these issues? I would suggest that we have to back up and have a frame that will allow us, in fact, to eliminate inequities that are caused in the workplace. Now, first we can start. I know this is an American conference called in large part by NICE, part of the American government. I support that. But just as a scientific comment, nobody in the world talks about disparities but Americans. And that helps confuse us. You know, science is an interesting field, and if you use language that causes confusion, it slows your research down. Disparities are differences. That's what disparity means. Differences in health. My health and the health of my brother here are different. We got different equipment. We got different anatomy. Inequity means something is wrong. We would expect, or we wouldn't be surprised, that the exposures that a steelworker had would be different than the exposures that a secretary in an office might have, or that a teacher might have. What we don't expect, what's wrong, is if the steelworker dies consistently earlier than the school teacher. That's called an inequity. It's unfair, it's unjust, and it's preventable. So first, let's be really clear what we're talking about. I do have an interest in the disparities that exist in workplaces. But that's not what this conference is about. This conference is about the fact that some workers consistently are injured more often and die earlier from occupational disease and injury. And that we think that's wrong and we want to correct that. So we have to look at it from two sort of frameworks. The first, and I frankly think this is the most important, we're not going to spend a lot of time talking about it in detail at this conference, but I mention it because I want you to think about it and find a way to weave it into the discussions we're going to have. The first are the big macro factors. How do we have inequity in the workplace? Why is it that foundry workers die more frequently? How come coal miners go down underground and have the stuff collapse? What is going on? This is a result of large social forces. We can use one word, power. So one of the major frameworks that we have to think about inequities in the workplace is what is the power relationships in the workplace. And they are a reflection of power relationships in the general society. So we have to be clear, and we have to address it. How much power labor has to elect people to Congress, how much power labor has to determine the working conditions in workplaces, determine what exposures, what toxins, what working conditions, what the shifts are. And those impact people's health. And these power relationships inside the workplace are directly related to power relationships outside of the workplace. So when those brothers and sisters at the Hyatt Hotel leave those horrible jobs where they're treated with disrespect and expected to turn hundreds of pounds of mattresses with no support, no help, no proper equipment, they usually go home to communities where the housing is not the best. Some of them are homeless. Their children go to schools where the roof leaks, the class size is 40, and they're not taught how to read. They live in communities without sustainable, good food systems. And in this, one of the richest nations of the world, sitting in the city of Chicago with more medical schools than any other part per capita, than any other part of the country. They sit in a country of, even though we have passed a historic health reform bill, that refuses to recognize the fact that even if you work part-time, even if you're unemployed, even if you're an immigrant, even if you're here without legal papers, you deserve health care. It's a basic human right. We should not tolerate a piece of legislation that explicitly excludes a group of workers simply because they don't have documents. It's inexcusable. When you have a presidential candidate suggesting that Social Security is a Ponzi scheme, we're in trouble. So trying to figure out how to do health and safety education to people for whom English is a second language is important. But if you don't understand that you have to help them understand the power relationships in their new country, they're not going to be able to change the workplace. We cannot ignore those huge macro factors. The second set of factors that I think our discussion papers eloquently discuss, and by the way, many of them made some of these connections back to the macro factors. I don't want to act like they only concentrate. Deal with things directly in the workplace. What exactly are the employment conditions? If the unemployment rate is high and you act like you want a respirator, or maybe you shouldn't do that particular task, and the boss knows he can get another replacement worker tomorrow, maybe this afternoon, the power that you have to actually impact those conditions is lessened. If you're working in the informal economy that's not tracked, in our sweatshops, they are here, hidden away in residential neighborhoods of this town, you don't have a lot of power to be arguing about the national legislation around wage. Those macro factors have to do with what are the exposures in a plant. How big is your workplace? If you work in a small workplace, even if you're down on the job, it may not have to be reported because it's too small. But most Americans work in small workplaces under 50 employees. That's why we need that new legislation that covers all workers wherever they work, whatever the size. The reality is that where silica exists, where lead exists, where bad ergonomic design exists, is distributed the same structural way that those macro factors are distributed. They're distributed on the basis of race and ethnicity, on immigrant status, on gender, and on class. So people in the lower classes have more exposure than people in the middle classes. So in our discussions, we're going to be looking at these detailed factors of what information and research we can gain from studying them. We should ask ourselves, how did we get here? How is it that we made progress from 1911, when Alice Hamilton went through industry in this state and documented foot drop and wrist drop from lead? But we still have workers that are poisoned by lead 100 years later. We have to understand that the thinking process in this country now that is dominant is an ideology that argues that the individual is everything. It raises the role of the individual to the level of a religious icon. So Americans believe that they're all middle class. A statistical impossibility. They believe they all will win the lottery, and therefore they argue they don't want high taxes because they might be rich one day. Actually, their taxes would be lowered, I think. And they argue that government is useless, and the problem and the collective action is futile. So we need leadership from you. literature says clearly, not as clearly as we might like, that collective action works. We know that if we collectively come together and change conditions in workplaces, we improve health, we save lives. And that struggle is tied, and always has been tied, to social justice and social movements in this country. So the fight to eliminate slums has always taken place with the fight to clean up the factory. The fight to protect the public from rotten meat was successful as the meat packers union grew in strength. They are connected. In fact, I think the most interesting question is not so much why some groups of workers have worse health and how is that connected to their workplace. I think the more interesting question is, what's the relationship between the power of workers and the health of the American people? When workers are strong, they rearrange how resources are distributed. They reject the notion that class, race, and gender should determine the fate of their children, the health of their parents, the safety of their jobs. I think the evidence about the relationship between the power that workers have in general society and in the workplace is well established internationally. I think it's well established in our country. I want to quote Dr. King, who said, "Rarely do we find men who willingly engage in hard, solid thinking. There is almost a universal quest for easy answers and half-baked solutions. Nothing pains some people more than having to think." We know what has to be done. Alice Hamilton knew what had to be done 100 years ago. And we know that what goes on in the workplace, and obviously the health of workers, is not determined solely by the toxins and dangers in the workplace. We know that social and political circumstances that arrange the distribution of resources determines all of our health. And so all the policies that we talk about should be framed around that question. Does this contribute toward erasing health inequities, or does it contribute toward widening the gap? And that means even at this conference, we have to directly tackle the distribution of power, money, and resources. We don't even know how many people drop dead on the job in this country. We haven't even figured out how to count that. My granddaughter can count when somebody drops dead. But we as a field manage not to be able to do it. So we have to fight for better surveillance systems, not just occupational fatality surveillance systems, better public health surveillance systems. In the occupational setting, we don't know how many people are exposed to lead. We make these estimates. How many people are exposed to beryllium? These are the ancient poisons, much less the new multisyllabic poisons that we have. We can't track over a lifetime what a given worker's exposure has been. If they come in to see you, you don't have a clue. You're guessing from what they tell you their job description was. That's unnecessary. It's criminal. It's unscientific in today's age. So we have to fight for systems that demand that we're able to track exposures to individual workers, exposures to group of workers, and exposures in the community. The biggest lessons for us is that if we're going to eliminate health inequities in the workplace, we need strong, bigger, militant unions. And we're in trouble. This is family, below 10%. We're in trouble. And the whole country's in trouble. Because organized workers who can exercise their power at home and in the workplace are the best guarantors we have for social justice. Equity and social justice does not stand outside of our field. It is part and parcel of occupational safety and health. We have to embrace racism discrimination, if we're going to really look at how exposures in the workplace operate and function, we need to go back to basics. Everybody knows this. The well-being of people is determined by power. So we have to ask the old questions. Who are our friends and allies? Who are our potential allies? And who are our enemies? NFL star Gobert said, if you run out on the football field and you don't know what uniform your team is wearing, you're in trouble. We did not save those 400,000 lives in the past 40 years through smart lawyers. They were helpful. Not by clever physicians, always useful. Not by persistent industrial hygienists or safety engineers. Not as a gift from any political party we may have supported. Not by accident. Those 400,000 lives were saved by the sweat, blood, and yes, deaths of thousands of workers. Workers have a basic right to protect themselves and organize. When they do that, they protect the rights of all people, our families and our communities. When we remain united, we're able to solve difficult problems. Sisters and brothers, there's a war afoot. I'm not talking about Afghanistan. There's a war, and we're going to examine in this conference the front line of that war, the people at the greatest risk. It's an old war. Don't believe me, take a trip to Detroit. Heartland of the nation. Industrial might. Strong militant union. Take a trip to that city. We lost that city, and we don't even recognize it. It's a war against women, against workers, against people of color. It's a war that reaches down and destroys our children. And in the past few decades, our enemy has escalated their efforts. And frankly, brothers and sisters, they've been winning. We need to say these difficult words out loud. This is a racist class war that's killing us. And there's only really one question that we need to answer as scientists and health and safety professionals. Which side are you on? Thank you.